Okay, well, let's get started. I know some more people will be joining us in a few minutes, but first of all, welcome. My name is Madison Rich. I am the Program Manager for Healthy KC at the KC Chamber. Thank you for joining us for this webinar, Continue the Chat about Workplace Mental Health. I do quickly thank our sponsors. So on the next slide here, you'll see all of our Healthy KC sponsors. They are very supportive of everything we do. Special shout out to Blue Cross Blue Shield, Reach Healthcare Foundation, and Lockton, and a number of other Healthy KC sponsors, like I said, you can see on the screen. So with that, I'm just going to go ahead and turn it over to Nancy Spangler, who's going to get us started today. Nancy Spangler is the president of Spangler Associates, and she helps lead the work for the behavioral health group of Healthy KC. So Nancy.
Thank you, Madison, and thank you everyone for joining us. I know that some of you joined us in November when we started the chat, and some of you joined us in March when we continued the chat at the annual Healthy KC meeting. We decided to continue this chat well before the coronavirus hit. It's just ironic that we had it scheduled for now, and I think it's very timely. So I'm hoping that you personally get something out of this, but most importantly, that you take something back to your organization that's useful and helpful. We have some intentions to start with. We're reviewing the Kansas City Workplace Mental Health Assessment, the final report. We did talk about this in March, so for some of you, it's a bit of a repetition, but we are just highlighting some of the important points and key takeaways. We're also discussing some of the local and national resources which are part of this report, and we hope they will be of value to you. We will then talk with Kansas City area employers, representatives, different kinds, about some of the ways that they already looked at mental health, and then ways that they have addressed the unbelievable needs. In fact, some of us on this Workplace Mental Health Collaborative team have worked for years, decades even, to draw attention and get visibility for workplace mental health and community mental health. Who knew that all we needed was a pandemic and suddenly the world over would be paying attention to mental health? We thank all of the panelists who are joining us today. And we will go through each person, and they are here as well on the side, so you'll be able to see them live as they speak. I'm also giving a shout out to these people at the bottom who have been a part of the Workplace Collaborative team or are getting ready to join us. This work has been going on for a while. We discussed how to address the community and workplace mental health full spectrum, from thriving and mental well-being to mental illness and disability, because it is a broad spectrum and it's something that all workplaces face at some time or another. We decided to begin by gathering information first. So we worked with 3 organizations, national organizations, who had developed an assessment to gain information about what workplace efforts were already going on. The respondents, as last time when we did the interim report, showed that our participants were primarily from wellness, human resources, and that's the area where many times mental health initiatives begin. So that makes sense. And what we learned was that the representatives suggested that the majority have some mental health issues that are being covered. So there were a wide variety of ways that mental health was being discussed. But what we found was that training was being provided to managers in ways that were less than active. There was a lot of value for EAP programs, And that is a strength in our area. We have some wonderful EAP programs. And yet some of the comments suggested that EAP is somewhat passive and requires a participant to reach out to EAP. Managers have some tools available and resources that they can use for people who might be experiencing mental health challenges. And yet that active training for managers to know how to use that tool and the EAP resources is somewhat lacking. Areas for those who said they are doing training, for that 26% who are doing training, 20% said brief mental health awareness training for managers, which is extremely important. Mental health first aid, which is extremely valuable, particularly and health people in general and teachers, and then accommodations for stay at work or return to work. So there are a few organizations that were using data to assess what is needed and what is not working. This 29% said yes. And if yes, the main area was EAP utilization. That makes sense. But there is a whole lot of other data that could be used to help organizations get an idea of whether or not their mental health efforts are working. So that's an area for opportunity. And few organizations are getting feedback they would like. And few are asking, what about work practices, policies, and structures that affect one's mental health? I'm going to talk a little more about that in just a second. So we see an information gap. And another question that we asked is, does your organization have an action plan? Do you have a strategy for how you're going to address mental health in the next year or so? So they're using EAPs and mining that kind of information. So in some ways, that could be a drawback, because then an organization feels like, okay, well, we have an EAP, we're good. But there are lots of other ways that we could get information and share information that could be more active and proactive. Trauma is an area that the Chamber has addressed through its Resilient KC several years ago, and this continues in Alive and Well with Abe Stokes' work, one of our team members. Trauma history affects workers but there are things that can be done to build resilience. This is an area of great opportunity, and just a few are addressing it. Providing some resources and awareness education. And yet there, again, is more opportunity for more in-depth training, particularly of managers. So we did some comparisons to others were able to take the same assessment, and yet we personalized it just for Kansas City employers. But one thing that we found that was a strength of Kansas City is that there's a strong perception of a positive culture and an accepting culture around getting help for mental health. So using services would not affect one's opportunities for promotion, et cetera. And that number, so I think we should feel good about that. It suggests that we're building tolerance here somehow. Another area of strength for Kansas City was senior leadership. So the senior leaders here, 61% were rated as actively engaged in supporting employee mental health. And the three biggest areas of address through policies, practices, and structures were safe work environments, respect, civility, cooperative work and relationships, ethics, values, and mission alignment. And nationally, that number was only 37%. So again, I think we should feel very good about that. In summary, there are some strengths for Kansas City are positive culture, our actively engaged senior leaders who support the ways that we work that can be helpful for people EAPs. Keep in mind that those resources are somewhat passive, so we need to get the word out to people and use our EAPs more actively. Some of the needs include visible senior support that reduces mental health stigma reduction. So senior leaders are supporting work processes, but we could use them actively talking about mental health as well. We could also use more tools and trainings, especially for managers and supervisors. And we could use data better to create strategic action plans. Some of the comments from participants did ideas about giving greater attention to the care system and better access. So we will hear a lot more about that in just a minute. And then some peer-to-peer networks. So ways to help people talk to one another about what they're doing and what works for them. So one part of the assessment report that I wanted to point out is a resources that employers might consider for VFU training and just a general awareness of what community resources are available to your employees should they be struggling. So I just wanted to point that out. The resource guide is also on the Healthy KC website. So both ways, you can print one off from the, you can download a PDF of the assessment and you can print off that guide, or you can do this active resource on the Healthy KC website. I also wanted to point out there are a number of national resources. This cyber guide, a review of mental health apps, is really an excellent guide. They've reviewed and tested some of the mental health apps like Calm and Headspace and a number of others, just a whole list of mental health apps that you might be considering for your employee populations. Also, Mental Health America, the national office, has a download you can use to do your own Mental Health Month communications. The website for the assessment has a list of resources as well, lots of national tools. I wanted to point out this OG Life Lab is an app. It's a new one, so it's not included in the cyber guide above, but they did a really excellent coronavirus leader guide. So some of the tools that they use in their app are available for free at this location. One of the things that they use is a mood meter. And what they discovered was that some of the moods that people recorded in this interactive app before the coronavirus hit included calm, optimistic, content, hopeful, and happy. Those were the predominant moods. After the coronavirus shutdown hit, the predominant moods were anxious, exhausted, confused, and still optimistic and hopeful. So I think that's an interesting indication of what's happening in our country emotionally. Healthy Minds is another app that wasn't included in Cyber Guide, but has some free resources. And then these others have some really excellent resources as a result of the coronavirus. So one thing that we didn't share at the beginning is if you have questions as we go along, feel free to use the chat function, and Madison will be monitoring the questions, and feel free, Madison, to draw in as we discuss with our panelists how the audience is engaging and what questions they have. So with that, I would like to begin our review by welcoming
Nancy.
Haley Prophet, and actually, yes.
Sorry to interrupt. We're having some issues with your connection a little bit. I think overall people are still able to follow along on the slides, but just wanted you to be aware that there's a little bit of a delay.
Oh dear. Okay. Well, hopefully
we'll get through it though. It's okay.
I've experienced that. I'm sorry. I'm sitting right next to my router and my modem. Okay. So, well, let's just go to each speaker one at a time. Our first speaker up is Haley Prophet from Garmin, and Haley has been doing a number of things for years, several years, in terms of emotional well-being and mental health. So welcome, Haley.
Thank you so much. I'm excited to be joining this morning. So just wanted to kind of start with some of the things that we've been doing both before pandemic, but even just longer history at Garmin. For us, bringing up mental health and mental well-being has been a really important topic to us. We started that, 7, 8 years ago. And for us in a corporate setting, it was really important we did so in a diligent manner. And so in order to do that, we began conversations on mindfulness, meditation, awareness of feelings, stresses, kind of the whole gamut. And then we've been able to really tailor things along the way. And that's been a great transition for us, really embracing that it's important for us as an organization, our overall focus on the employees and what their mental health is, that of their families, but really the importance on connecting the dots on the resources that we've had internally have been one of the key things that we have wanted to focus on. I'm not going to lie, since the pandemic, things like stress and anxiety and depression, a lot of those have really come to the forefront, but have been something that everyone's much more comfortable in talking about. So we've also embraced that. It isn't unbeknownst to our organization that there is a tie with physical health as well. And so we have quite a bit of data that we have shared on the Garmin blog as well that correlates physical activity to mental health, to the psychological state of so many Americans right now. And so that's definitely been a transition for us in recent weeks, but a good thing to be able to focus on. When we wanted to really bring mental health to the forefront, we just jumped all in. There was no other way to do it than to bring it up and make it a comfortable conversation. We definitely want to demystify the taboo, especially in a workplace, and bring it into our community as a regular conversation. So it's been really important to our organization for a number of years to focus on Mental Health Month, Suicide Prevention Month. Resiliency has become its own entire bucket for us that can feed into mental health, but it can also be a standalone program. We have an internal program that we call Adventures in Resilience, and that really allows individuals to discuss really hard conversations about things such as depression and anxiety that they may be struggling with themselves or family members that they may have, but also how can they be resilient? How can they practice those exercises and those techniques? How can they leverage resources that they have for themselves? And that's been traumatic. Yes, go ahead.
You've had that program in place for a long time, right? So
yeah.
Has served you well to have that language for people to use.
Absolutely. And that's a great example for us in bridging the gap. When we came about creating Adventures in Resilience, I did have meetings and group discussions with a wide range of associates representing our organization to determine how we could best integrate some of the terms, some of these concepts. It wasn't that there was, fear or hesitation about talking about anxiety, depression, suicide in the workplace. They really wanted the content. They just wanted it in a very palatable manner for our population. And so resilience was by far the term that stuck out to our individuals, and they really, really grasped it. We utilized the PHQ-9 assessment when we launched this 5 years ago, if not more now. And that helped us just to have a benchmark on where to go.
Would you explain what the PHQ-9 is?
Sure. And so that's assessing an individual's current state. And so we used it as a pre and post evaluation during our initial launch of the Adventures in Resilience campaign to really determine How are they feeling in that time? Do they have positive outlooks on things? And it's a really easy assessment for them to go through, and just quick reflection. So it's not too introspective, but then you can move on. And for us, it was being able to correlate the pre and post evaluation of a lot of that information that was extremely helpful for us to drive continued initiatives and efforts to think outside the box even a little bit more. So as we have continued to evaluate different things in that area, we do understand that there's a broad gamut of what we want to tailor, what we want to focus on. And so some of the more recent things in recent months and years have been focusing on the manager aspect. And beyond trainings. Trainings are fantastic, but a lot of times there's so many different modalities to deliver that content. And that's what we've really wanted to focus on for our managers, especially as we're a growing organization. So we've worked with Workplace Healing LLC here locally in Kansas City. We also worked with them to host a virtual session for field office managers. And again, it goes back to the terminology, bringing up resilience, bringing up things like trauma, return to work. You know, as a manager, you're focusing on how do you bring your individuals back? How do we have conversations about productivity? And that's much more broad in terms of this isn't just your professional productivity and the tasks, but as an organization, broadening our term on productivity to be personal productivity. You know, how are you doing with your own health and well-being, and how does that filter into your work as well, have been really impactful.
I have a question for Haley from our chat here. How many Garmin employees take advantage of these programs?
Yeah, absolutely. I do have to say, and this is in complete transparency, I'm very lucky that my well-being program is not directly tied to any other benefit in terms of they have to enroll. So ours is not tied to our medical plan. I think that the huge benefit for us that we've embraced in the last 10 years in my time there have been individuals are reaching out to the program because they want to. We also offer all of our well-being initiatives to our spouses and dependents, whether they're on our medical plan or not. Again, the benefit to it standing alone is that they don't necessarily need to be enrolled in our medical plan. The manager training, for example, we hosted one of our first in-person live sessions last year, and we had over 200 attendees at our headquarters campus. So we feel really positive about the individuals that are engaging. And even more so, we aren't focused on the number of people participating as opposed to what's the quality? What are the outcomes and results that we're hearing? How do we see folks evaluating themselves at the end? Because we know if we have a population struggling and there's a pocket of individuals with depression or anxiety or suicidal ideation, either for themselves or someone at home, we want to know that we're giving them the right education and resources and tools and knowledge and education, both in the workplace and at home, to mitigate as much as we can. And so for us, that's a tremendous opportunity and what we really like to leverage to bring in the holistic well-being approach. So when we talk about things like mental health, we're directly tying in physical activity and what that is doing for your psychological state, nutrition and what that is doing, looking at sleep. And we're not just looking at the length of sleep you're getting, we're encouraging associates to really assess the quality of sleep that they're getting, utilizing their wearable device to track their stress levels. And, you know, how is that correlating with what they may self-report for a current stress level of themselves, monitoring heart rate. And so really trying to dive into as many analytics as we can to reference potential that they can really focus on that are going to drive that mental well-being for themselves as well.
Good question.
Yeah, absolutely. And again, I would just really go back and emphasize, you know, the productivity piece and how important that is for us, telling the story internally at Garmin that, you know, productivity isn't just your performance at work. While that's absolutely important, and that's something that we bring up in our manager trainings, if they are coming to work and they don't feel that it's a supportive environment, they don't feel like they have go-to people in the work organization that they can trust and befriend, if they don't feel like it's a safe environment, you know, if there's other concerns that are going to diminish their feelings and feel as if they can't own, you know, their depression, their anxiety, then it's going to be a really tough work environment. And so we want to mitigate as much of that as we can right up front. And so implementing new programs, new resources. One thing that I absolutely love that Garmin embraces and allows me to continue to support is the modalities that we're offering, knowing that as we grow as an organization and our headcount numbers, we must have modalities that are going to appeal and apply to anyone in any situation, whether that be, demographics, geographics, family dynamics, even just access to the care. And so it's really important for us that we're educating individuals on just all the resources that they have available to them.
That's a really good point, Haley. I really love how you, as I mentioned in the beginning, you are talking about the full spectrum from self-care and how people can stay well and thriving, how they can access help, and then for managers, how to help people return when they've been out on some mental health or stress-related or trauma-related disability leave or family leave. So
absolutely. Yeah. And I would just close, echoing the concept of today being continue the chat. It truly is the conversation. It's the conversation I have with our individual contributors. It's the conversation I have with my HR team. When I'm face-to-face with our leaders in our organization, setting the tone that it's okay to bring these up, because I will be honest and tell you, talking about mental health or wanting to bring up Mental Health Month, Suicide Prevention Month, it has at times been a challenge in the organization, and some of my leaders have questioned, is this okay? What is the feel going to be? Is it going to be receptive to those that need to be there and want to be there? And I will say that they've all trusted me, luckily. And every time we do, again, even if it's one individual that comes and has the confidence and the comfort in our environment to bring up that they have a spouse at home that has suicidal thoughts, that they're very concerned when they leave work every day, and we're able to create an environment where we support them and we're helping them and giving them resources, and they can even create a community internal at Garmin where they're creating that and finding that support themselves, then we know we've done the right thing. And that's what we consistently see from our programming efforts.
Excellent. Thank you, Haley.
I have one more question for Haley. I know we have to move on to the next, but just one more quick question. And I know you've hit on this a little bit, Haley, but from the chat, how do you work with the taboo of mental health?
Absolutely. It's a tough one. And I think it goes, back to what I was saying in the beginning about the terms. And we don't want to diminish terms like mental health and mental well-being and behavioral health. They're very important. But knowing that there are certain portions of our population that might not be receptive for them. And so utilizing a lot of other terminology. Adventures and resilience is one of our best examples of that, utilizing the resilience campaign. Yet through resilience campaign, we're discussing mental health. We're discussing all sorts of diversity that can go on within a team, such as anxiety, depression, bipolar, so many different things. But it's embracing that as a workplace, these things are happening, and we can't draw a line and expect them to not bring it to work or not take it home with them. And so how can we continue to have this conversation? How can we call it what it is and work on resolutions that are going to be most impactful for those individuals?
Excellent. Okay, thank you, Haley.
Thank you.
I wanted to ask you, Madison, my watch has stopped and I cannot see the time on my computer because my slides are up. So it would be really helpful, and you did an excellent job of making notations of who's to speak when. So it would be really helpful for you to come on as you have to help move us along when the time is right, if you would.
I will come on, I will show my face, I will wave at you if we're going over. So we're doing well on time, so I'll let you know.
Okay, thank you. And thank you, audience, for asking questions. Those were excellent. So next up is Candy Hawks. Candy is the Employee Wellbeing Coordinator for Blue Valley School District, and we welcome you, Candy.
Yeah, hi. Thank you so much for coming and joining today. And Nancy, thanks for the introduction. I hope that at least you take something away today, whether it's from me or from Haley or Dennis later, something that you can take back that's more applicable for your site, because we're all different, right? Each site has their own needs. So I think that's what's important about the mental health and just well-being overall, is making sure that we're assessing the needs of our particular organization and company, right? So before COVID-19 hit, we focused on the overall well-being. So mental health has always been a part of our plan. But now with COVID, it seems like making mental health resources a little more applicable and that more known. And I'll talk to this, and I know Haley talked to it too, about just the awareness factor, making sure that your staff knows what's out there and that how to access it, right? So that's kind of been my backbone to this, is more about the awareness of what's already there. So looking at my slide, so we developed these brochures and employee badges. So we wanted something that if they had a quick question, or they just in a moment of panic, basically, because a lot of ours are staff and teachers, right? And they're maybe come up with a quick, they just need a quick breather, right? And so we thought maybe a mental health note card. It's like steps to take, one quick steps to take. And then if it goes beyond that and they need to call like a national resource or local resource, it's a little tag that attaches to their badge just for a quick reference. So these were distributed through our principals. So talking about managers from a corporate setting, our managers, so to speak, are like our principals, our administrators, right? And so we use them kind of as our facilitator for this. So we directly use them as our tool for them to start the chat, making sure that their staff in each of their buildings, we have 42 buildings, making sure each staff has a direct link to knowing that it's okay to talk about this. And so we use the principals as our launching point to start the chat about mental and behavioral health. We developed an intranet site that's directed toward mental health as well. We have other things on there as well as far as well-being. And the brochures that I just mentioned above, they have a QR code that the staff could just scan, and it takes them directly to topics like stress and resiliency, emotional well-being, and work-life balance. Those are the kind of the top three categories as far as mental health. We also partnered, we're fortunate to be a school district that has a program called Center for Advanced Professional Studies, we call it CAPS, on a mental health program awareness campaign. So I knew we had a lot of programs and tools out there, but it just didn't seem like our staff knew about it, right? And so kind of like what Garmin has with their adventure and resiliency, I think it was kind of like a campaign just to bring people to be aware of what's out there. And so we worked actually with a student, it's convenient for us because we are a school district. It was a high school student who developed a video that we distributed to all staff regarding the importance of mental health for our educators. And we feel that coming from one of their own students, speaking about how it's important to her and how it's important that her teachers that she works with day to day are taking care of themselves, so then they too can benefit from that. So we think that perspective, kind of makes it a little more impactful for them. Just typical online wellness challenges as well, devoted to self-care, because sometimes people, we find, don't want to reach out. They have that stigma. So if they don't feel comfortable, at least there are some options to where they just participate in a challenge, but they're still taking care of themselves, whether it's self-care, mental health. We just did a mindfulness challenge recently that just ended a couple weeks ago. So I think there are different tools and different resources that I think is important to bring in for mental health. And then of course we have behavioral health counseling through our EAP, in person and virtual. So that's a great segue into, since COVID-19, we've used the virtual behavioral health became a little more prominent, right? So, and it also became free. So for a time being, they don't have to pay for virtual behavioral health coaching. And we have two different avenues. So if they're not on our benefits plan, there is another option. So basically all staff could access this. And like Haley mentioned before, Garmin's using the Workplace Healing LLC. Blue Valley is also scheduled for them to speak. However, it happened during all of this fun stuff. And so we opted to reschedule our program in the fall. So hopefully it'll be one-on-one with our manager or our administrators. However, we thought that now is a more important time for them to have this information. And so we're fortunate that we collaborated with them and created a mental health newsletter with several of their key messages about returning to work and empathy. And then we also updated our benefit resources. So we directly informed our administrators so then they can too pass it on to their staff. Virtual behavioral health counseling, coaching became free, like I mentioned. Then we also developed a new section on our intranet site that's solely devoted to COVID-19 well-being. So self-care in the situation, mindfulness during this time, coping while you're working from home. So a wide variety of options that they could very quickly look onto and access. And then finally, continuing our mindfulness online challenges. Like I said, we just finished one up a few weeks ago. We moved, of course, all of our in-person classes to virtual, so they still had yoga that they could do at home. Desk exercises, which I lead, and it's just visual stretching that they can do for 10 minutes, and they can just log on and we just go through it. Zumba, just classes that now are virtual. And then providing professional learning online. So we have a separate resource that teachers use for basically everything. And so we added a mental health webinar basically in there for them to use and to access, and it's recorded so they can use it at any time and reference.
So one question I have for you, Candy, is
Yes.
Knowing some of my friends who are teachers and who are talking about the challenges of how school ended, and I'm sure some of your teachers are continuing to contact students and that sort of thing. Has there been a way to connect teachers to teachers to talk about, just the challenges of how their work has changed and the stress?
Yeah, that's a great question, Nancy. Our administrators are amazing in Blue Valley. So our principals, they're that direct link between and that connection. And I know a lot of I speak with our administrators very frequently as far as well-being with their staff. And I know a lot of their themes, teachers are about themes. A lot of their themes is about connectivity, and they're doing lots of connection, of course, through Zoom, and a lot of drive-by type of greetings and banners and things. So I think that's the resource as far as staying connected right now. But I do know, I just recently saw one of our principals, it is a struggle right now for the teachers. They're going back into their classrooms now where it's empty and it was left on March 16th or whatever, and their students aren't there and they can't say goodbye, and they're collecting all of so it is a tough time right now for our teachers. And as much as I think they're stressed about it, they really care about what they do. So it is a tough time for them right now. And so I think right now it's just making sure that they have these resources, know where to go, that their principals know where to go, and have that connection to us, and that it's okay. I get emails frequently from teachers and principals, where can they go for this? So I think it's important to have that, me as a confidential resource too, as far as their well-being coordinator to turn to, knowing that it's not held against them that they're reaching out for resources. It's a good question, Nancy.
I have a question from the group, and I just want to quickly mention we're going to do some Q&A at the end. So, excuse me, we'll have some questions for all of our panelists at the end. And if we do miss any of your questions, we'll make sure to get those answered and sent to you later. So I'm keeping record of all of those. So if I miss your question, I'm not ignoring you. We will get to it, I promise. But I do have one. Specific to a school district, do you have any ideas or advice for keeping well-being going during the summer when a lot of the staff is off?
Yeah, no, that's a great question. And we do have some well-being programs going this summer. So, and again, it's also about letting them know ahead of time, because end of May in a few weeks, a lot of them really don't recheck things like as far as emails and resources. So it's a matter of letting them know what's going on now. So, in the past, we had some on-site things, but this summer we have some on-site or some virtual yoga. And so we have an instructor who's teaching it, so they have access to that. So just kind of de-stress during the summer. I'm actually starting, it's a positivity challenge. So their challenge over the summer is to take pictures of nature scenes and things that they come across over the summer that makes them feel good. No people in the picture, so animals and natures and things. And then when they come back in the fall, we're going to gather all of these pictures to make little cards and things for them for each building to access later, just to kind of reference along with positive affirmations. So I think it's just something to keep them focused on during the summer. So little challenges. Last year I did a self-care challenge, a summer self-care challenge. It's like a bingo kind of thing. So if they did different things, over the course of the summer, and then they turned it in and they get, different incentives and things. So I think it's just a matter of being aware of these programs, having some programs in place to kind of keep them focused on taking care of themselves over the summer, and then almost holding them accountable when they come back to turning things in, say, hey, I did do this. And it's gone well. Thank you for asking.
That's a great idea, Candy. And for people out there who are new to this whole mental health realm, there may be some, who think that's kind of touchy-feely. Well, actually, there's really good research evidence that suggests touching base with what brings us joy, what we're grateful for, what uplifts us, works on neural pathways that reinforce well-being. So,
right. So it's without saying this is for your mental health. It is, but let's look at it differently. Right, Nancy.
Yeah, your whole well-being, and in that way, you're helping your mental health.
Right.
So, great idea. Okay, thank you so much, Candy. Our next speaker is Julia Hawley. She's the director of LifeWise at St. Luke's Health System, which includes the EAP. So welcome to Juliet. I wanted to point out that St. Luke's has had great collaboration for decades, since the 80s when I worked at St. Luke's. And this way of bringing it together that Juliet has done is unique in many ways, and I think highly effective. So we welcome Juliet.
Yes, thank you, Nancy. Good morning, everyone, and thank you for inviting me to participate in this really important conversation around mental health. So before I begin, just a very brief history related to St. Luke's Health System. When I talk to people, many people are surprised to learn that St. Luke's Health System has a very rich history in working with employers in the Kansas City market. In fact, St. Luke's Health System has been providing corporate health and wellness services as well as mental health services to employees within the Kansas City market for over 40 years. So we do enjoy a very rich history there, but along the lines of behavioral health, we currently serve, our LifeWise EAP program currently serves our health system, which is comprised of approximately 12,000 employees as well as their dependents. But we also serve about 100 additional client organizations that are rooted in Kansas City, but also have employees that may be around the world. So we serve employees around the world. And most people are surprised to learn that we have that much breadth within our EAP. So the slide that I'm going to be sharing with you speaks to, I believe, how our EAP has evolved over time to meet the changing needs of the clients that we serve. But I think it also speaks to what we have done in an attempt to reduce the stigma around seeking mental health services. And so this slide really, I think, paints a picture of how we've evolved. And in fact, if you don't mind, I'm going to supplement this slide with a little additional information because we have had some updates with regards to what we're doing. But initially, one of the major changes that we made was back in 2014, we incorporated all of our corporate health and wellness services and mental health services under one umbrella. We put all of that under the LifeWise umbrella. And we did that for a couple of reasons. One, we felt it was very important to promote this aspect of well-being. So not just health promotion, not just mental health, but we wanted to promote well-being. And so we wanted employers to have the capacity to go to one location to build the well-being program that worked for their organization. We're not firm believers in a turnkey approach or one size fits all. So employers had the capacity to build a well-being program that best suits their needs. But also, and probably more importantly, consolidating all of these resources under one roof enables us to reduce the stigma around seeking help within the EAP. So the EAP then becomes this wide array of resources and tools that employers can access, as well as our own employees. One of the other things that we did was we had all of our clinicians certified as professional coaches. And this was a very big step for us. So today, when you engage with our EAP, you can meet with a clinician who provides counseling or coaching. And so if you come into our EAP office, you have the capacity to exchange your counseling benefit for coaching. And we have seen this as being a huge door opener for us in terms of reducing stigma and just getting people to engage with the EAP on a whole new level. And it also serves to demonstrate that the EAP is a resource not only for personal needs, but for professional needs as well. So that exchange is really important. All of our clinicians have since become trauma-informed trained. We are huge believers in the idea that we need to be serving those exposed to trauma in a more comprehensive way. We know healthcare workers, for example, are exposed to trauma every day. But being trauma-informed and trauma-trained has enabled us to work with first responders in our community in a broader way as well. So working with police, working with fire, working with people who are on the front lines, we understand the impact that their day-to-day work experiences has on their mental health. We also are keenly aware that we all come to work with a history and personal life experiences, and that trauma impacts outcomes related to mental health as well. We do a lot to promote the EAP as more than just a place for mental health services. We like to refer to the EAP as a location for learning. It's an opportunity to access tools and resources, as I mentioned earlier, for your professional as well as personal development. Again, that helps us look at the aspect of reducing stigma associated with EAPs in general. We do a lot with leadership development and training. And part of the beauty for us is that we have trainings that are developed by our clinicians, and our clinicians base our trainings on the latest research. And so what you're getting from our training team is not only the latest information, but it becomes a partnership in working with organizations to help build a culture of resiliency. And so part of our trainings are not only for our key stakeholders, but it's to help them anticipate issues that they might come across. We do an awful lot with resiliency. We do an awful lot of mindfulness, but more importantly, we customize those approaches to meet the demands and the culture of the organizations that we work with. We have developed a peer support program, and this is developed to look much like the Helping Heroes program for fire and police. It looks a lot like the Blue Dot program that Google is engaging with their employees. In fact, we're calling it the Green Dot program. And we are training peer supports to be either on the unit or on the floor. They are the places where we are not. And that program is designed to provide ready access to a support person who is there to listen if somebody needs to talk. The beauty of that is that oftentimes this peer support becomes the access or the gateway to helping those individuals get the support that they need. Obviously, we can't be everywhere all the time. So that has been a very enriching pilot project for us. Also, we have very strong supervisor case consultations. And the word troubled is on this slide. That's probably not my favorite word. It's really designed to work with key stakeholders around those very, very difficult situations where oftentimes they need to consult with an EAP clinician to determine the best course of action. And so building strong relationships is part of our model. In many instances, our clinicians are also account managers, so they can have a true understanding of the culture of the organizations that we're working with. Since COVID-19, or I should say, as we are still in the midst of COVID-19, we have launched virtual counseling. That was on our technology roadmap anyway. This sort of propelled us a little sooner than we anticipated, but we're very grateful for that, and that's something that we will continue. We're using the same platform to do something that we call virtual rounding. These are basically virtual support groups that anyone can engage with. So we have these regularly scheduled throughout the week. They're about 45 minutes in length. If we need a little longer time, we're happy to do that. It's led by a clinician But we offer two formats. One format is simply call in and chat if you would like to participate in a conversation around sharing what's going on within your organization. We also have areas that include topics that are led by a clinician also, so you can register for those and again engage in talking with others within your organization around concerns that you may have. The other thing that we've done is we've been working with a committee. We've actually co-developed a committee that is comprised of supports within our health system. And we call ourselves Because We Care. And it is inclusive of members of our health system, including spiritual wellness, human resource personnel, administrative people, all aspects of our organization. We've come together, we've developed a mission statement and a vision statement, but our primary objective is to have open dialogue around what we're seeing as the mental health needs are of our organization, to talk about the breadth of the resources that we have to support our own employees, and also, frankly, to be able to make some recommendations to our executive teams around what enhancements possibly could be made to our current benefit structure that would support the mental health needs that we're seeing. We have launched a new website, and this wasn't because of COVID, but the timing was sort of what it was. But we found it to be very fortunate, because obviously as people were beginning to move away from the office setting and back into the home environment, we had so many requests for resources and tools, videos, flyers, resources around childcare and elder care and financial resources. And so having a more robust website with enhanced tools has really been advantageous for anyone that engages with our EAP. And we also know that there are some individuals that will never set foot in an EAP office. They may never engage with a clinician, but what they do need access to is information. And so if an EAP can provide a robust website that has the tools that people are seeking, I think that's one thing that should be top of mind in looking at mental health needs of our own employees. And finally, I can't emphasize enough the relationships that we've forged with human resource personnel in particular. Within my organization, I have a direct reporting relationship to an HR leader within our system. I'm actively engaged with that team so that the EAP can be responsive to the evolving needs of our organization. And surely since COVID, we have a true understanding of how quickly those needs can evolve. I would imagine also that as we begin our return to office strategies, that we'll begin to see continuing evolving needs that our workforce will experience. And so these type of close relationships are what we do with our client organizations as well.
Excellent. It's just great work that you all have done for many, many years. I wanted to reinforce what you said about both the peer support and the coaching models. There is good evidence that it does serve as a gateway and reduces the fear and perhaps guilt and uncertainty and taboo for accessing further professional care for both mental health and substance use related disorders. And I wanted to point out that there was one resource that I failed to put in the national resources. MindSharePartners.org has done a lot of work on this peer support idea, and they have some examples of companies that they have a webinar that talks with employers that have used the peer support model. So that might be another resource, MindSharePartners.org. And I wanted to ask you, is the peer support program something that you're doing internally, or is that something that you can help external clients?
Nancy, I didn't really get your question because you faded out.
Am I cutting out?
Yeah, although I think I understand.
Juliet, were you able to?
I think I understood the gist of your question. It was around peer support groups. Is that correct?
Yes, and whether that's something you could help employers with, setting up peer support and
Absolutely.
navigate, because for one thing, employers are concerned at times about the legalities of that in terms of people coming forward and saying, I have a mental health, I have a history with a mental health condition. And there are companies that have gotten around that in ways that help them move forward then.
So we are still in a pilot phase. Our goal is to evaluate not only the efficacy of the program, but to look at the needs of the peer mentors or supports themselves. We want to make sure that they are equipped. We certainly are concerned about their mental health also, if they are the go-to people. And so we are going to be implementing this for 6 months, and we have some measures in place. And then we're going to be looking at expanding this throughout our organization.
Great. Madison, were there other questions for Juliet?
Yeah, we have a few, but we'll save those for Q&A just because we want to get back on schedule here. So I'm saving the questions from the chat for the panelists at the end.
Okay, great. Thank you.
Thank you.
Excellent work. Next, we are moving to Blue Cross Blue Shield, Kara Werner. Kara is Community Health Public Policy Advocate for Blue Cross, and welcome to Kara. We are fortunate to have Henry Hodis on our team. Henry was unable to join us today. Thank you, Kara, for pinch hitting. Are you there, Kara?
I am here. Thank you so much.
Are you able to see his Kara? There we go.
Are we set? Okay. It's a pleasure to be here. And it's been really great to hear about what everyone is working on and what everyone is doing. That's really hopeful and inspiring. So thank you for having me. So as far as, kind of what we're looking at for Blue, a lot of what I'm going to be talking today is what has transpired in our new kind of COVID era that we're in now. As far as community support goes, something that I've been really excited about is that free telehealth, including behavioral health, that we expanded beyond just our members to all residents of Kansas City, Missouri. And that is slated to go through, the end of the month. But, obviously as things kind of progress, that may be something that is expanded. As far as our members, we have free behavioral health therapy visits via our Blue KC app, and that is slated to go through the end of June. We also are utilizing a program called Mindful. So there are advocates that are licensed behavioral health clinicians who are able to match members to providers and just kind of guide those care plans. They listen, they navigate care, there's crisis management, benefits guidance, connecting and follow-up. So it's kind of a holistic sort of situation. And as far as for employees, we're able to engage in those mindful minutes and virtual morning coffee. So those are just weekly conversations held much like this, with different experts that can talk about, working from home, what managing stress looks like, anxiety during a crisis. Because all of us know that this shift was pretty quick, and people have had to navigate on a whole lot of different levels. From taking care of family members or kids and working from home, and access to the internet technical difficulties, different things like that. So that's what we're doing as far as, kind of internally and externally for members and for employees. The KC Health Collaborative is our Metro's regional health improvement collaborative. It's a membership organization, so it's comprised of payers, providers, health systems, employers, public health departments, community organizations, including the Chamber of Commerce. And we had been asked by the members to develop kind of a regional strategy around, supported isolation for those that have been affected by COVID, and then specifically the collaborative through tools such as a social needs referral network, trying to help coordinate the work of its members to address those social needs that are now more than ever having a big bright spotlight shone down upon, where some folks are falling through the gaps. And that includes behavioral health, domestic violence, intimate partner violence, and then again, just really trying to fill in the gaps where people are really struggling right now. And I believe, the website is listed there if anyone has any more questions about that. And you can also contact my colleague, Henry Hodes. His email is henry.hodes, Hodes, @bluekc.org.
So that bit that you mentioned about the screening for domestic violence concerns will happen through primary care physicians. So I think that's interesting for employers to know about. Frequently, when people first seek help for a mental health issue, it's through their primary care doctor. And being able to know that someone is having domestic violence concerns is really important for them, and referring for help. So that's really great to know that Blue Cross is leading the way in getting that implemented in primary care. I also wanted to ask you a question about the free telehealth for Kansas City residents. Is there a specific population that's available to, or can you tell us a little bit more about that, please?
Well, originally there had been, some talk about it being targeted for folks in zip codes where we were just seeing, higher incidence of COVID cases occurring in our community. But it's expanded to any KC resident. So if anyone wanted to access that, you would just go to bluekc.com/access. We're utilizing a service called MeMD. So you'll find, it'll walk you through it. I haven't looked at it in a while, but there'll be a place to get an access code, put in your information, request an appointment, and then everything will just be kind of set up through the system.
Interesting. That's excellent. Just a really wonderful thing for Blue KC to offer to our community, and excellent for employers to know about. I'm sure that there are some employers who are represented here by our audience who are new to this arena and may not have an EAP available, but have numerous employees who are struggling. So that's a wonderful resource to know about. Another question I had was about the mindful minutes and the morning coffee. How well attended has that been, and how deep do people get in terms of the questions they're asking, concerns they're expressing, and is it just interacting with the expert, or is there some peer-to-peer interaction as well?
Well, I'm going to be completely honest with you. I have not attended one. They always have managed to kind of fall during those time frames where I already have something else scheduled.
Sure.
So I can't answer that. I can find out though. And feel free to, I'll put my email address in the chat box. And if anyone has any other questions for me that I can't answer for you, please reach out and I'll get the answer for you.
Excellent.
Hi, this is Jonna Harris. If I can actually chime in on that call. I'm sorry, I'm not a speaker, but I am the Department Vice President of Total Rewards and HR Operations at Blue KC, and I'm accountable for what we actually do for our employees internally. So I hosted those coffees, so I'm happy to provide some data while we're here on the phone. So what we did was we rolled out Mindful by Blue KC, which is a new product we're going to be launching to the market later this summer. And we actually launched it to our employees first. And as part of that launch, we did our mindful minutes and morning coffee. And it was geared to be a 30-minute session for employees to log in and hear about what Mindful by Blue KC is. And then we also capitalized on having their attention to talk with them about how they might be feeling during this time and what is normal, and that there's a new normal and that everyone's experiencing what we're going through differently. And then we talked about the resources that they have available as a member of Blue KC's health plan, which is our EAP resources and our access to the mindful advocates, and that you can also text to get help if you need that, but really just trying to normalize the experience that people are going through and what tools that we have that maybe they didn't need to think about in the past. Based on our current situation, they would need to take advantage of those tools. The sessions, like I said, were only 30 minutes, and we had a mindful advocate, which is a licensed clinician, do most of the presentation during that. We've had 2 so far. They're once a week for all of May, and we've had 175 employees log on to each of those calls, which is way more than what we were anticipating. We thought we might get 30 or 40 people. So we think that virtual in the behavioral health space is great because it provides a bit of anonymity, so people feel more comfortable logging in and learning. And then we're also tracking on the back end to see what happens at our EAP, to see if our calls or our text therapy or the use of any of our tools spike. So we're going to use that kind of as a lessons learned. So we've been super excited about it, and people are engaging, which is what we want. We want them to learn about it. Even if they don't need it today, they might need it down the road.
That's just excellent. Thank you so much, John, for joining in. That was just, we didn't plan it that way, but thank you for letting us know you were listening.
Yeah, I'm pretty excited and passionate about it. So I'm sorry.
Yeah, that's great.
It's great stuff that we're doing at Blue KC to help our employees and our members overall deal with the current situation and highlight our resources that we have available.
You know, what we're finding nationally is that employers that are just providing some opportunities for people to connect, because there's a lot of loneliness for people who are isolated, but there's also a lot of too much togetherness for people that are sheltering in place with lots of family members and lots of complications. And sometimes it's nice for them just to have a way to get away from that and talk to somebody else for support who understands. So that's great. Thank you so much. So thank you, Kara, also for all that information and for joining us this morning. That's excellent.
Thank you.
Cross Blue Shield. Next up is Stacey Engelmann, Vice President HR Consultant with Lockton. And welcome to Stacey.
Thank you, Nancy. I'm thrilled to be here, and thanks so much for including us in this conversation and allowing us to share, a little bit about what we're doing, but before COVID hit and navigating through this interesting time. I keep trying to call it interesting instead of challenging and difficult and get that positivity spin on it. It seems to be helping a little bit, but really excited to be here and do what we can to help break the stigma around mental health. And, our teams at Lockton help our clients design and promote their total rewards, benefits, and well-being programs. So it's really critical for us to be what we feel a leader in this space. About 10 years ago, we implemented our wellness platform that really continues to evolve and has in the time that I've been there. And really work to have that well-rounded health and well-being program. And the message itself comes through, when you're a new associate, in our benefit guides, enrollment materials, and other communications. And I would have a copy of it with me, but we went green this year. And so everything's online, but as soon as you look at it, the message is that you matter. Your health matters, your wellness matters, your future matters. And we really hope that resonates with our associates throughout. Our wellness program is geared to really support the whole person, like physical health, mental health, and financial well-being. And, each year, as they go through what we call their health review, there's a focus that talks about the mental well-being review, and focuses on emotional health and mental well-being. And then based on the results of that, may provide them specialized training suggestions and other resources that they can access. In light of COVID, there's been a huge focus on communication and using that in a variety of ways to promote a lot of the resources that were already being provided to associates. Sometimes, if it's not staring you in the face, you forget about it, right? We've got a lot going on, especially right now. And it's easy to forget all of the great things that the organization might already be doing for their people. And so we implemented, it's called Workplace by Facebook, and it's a communication platform that was an amazing implementation effort across so many teams during this time, whether it was IT and our communications and marketing and human resources. They took that from about 6 months to a 2-week implementation. So it wasn't scheduled to be live yet, but in light of COVID and all of us working from home, fortunately that was put on the fast track. And that rollout has allowed us the opportunity to communicate multiple times a day regarding all aspects of our wellness program, and more frequently with our associates about resources in place, pre-COVID, but also what we're doing during this unsettling time. Right now, in light of Mental Health Awareness Month, we're sharing content and resources on at least a daily basis around mindfulness, tips, resources, and even just some facts about the prevalence of mental health and helping break the stigma there. We also have a fitness coach that gets on live once a day, every day, kind of around the lunch break, that will lead us in an exercise to help. We know that the influence, and everyone else has talked about this a little bit too, but the influence that mental health has on your mental well-being. We're also have continuous messages from leadership and that they're using to post on Workplace as well. So our COOs, and several other executives have recorded messages just to share updates about the organization, but also what they're doing to get through this interesting time, whether it's they're having focus again on maybe their physical health regimen or an interesting book that they're reading, and encouraging other associates to invest in themselves during this time as well. We have town hall meetings to bring people together at least every other week. And actually last week we had a guest psychologist present to our teams on mental resiliency and how to deal with some of the challenges that we're going through right now. Many of us are probably familiar with the concept of managing by walking around, right? And that's pretty difficult to do virtually when you are not walking around the office and seeing people physically and can acknowledge how they're doing. And we know that being able to work from home at a time like this, we're truly fortunate. But we also recognize that can feel unstructured, a little bit isolating for some. And like you mentioned earlier, the studies on loneliness and the impact that has on individuals' physical and mental health. And so our executives and managers have used this time to connect with associates, just calling them up, and whether that's personal phone calls or messages, even beyond their direct reports, on that frequent basis to say, how are you doing? How are you getting along? I just want to check on you, know that you matter to the organization. And that personal outreach and connection has really been key in all of this. We've also provided an additional day of vacation that associates can use to focus on their well-being, and encouraged to use it to focus on their well-being. right now. And we have a group called Parents at Work that was originally created or designed to provide opportunities to connect working parents and grandparents. We want to be inclusive of everyone who might be in that caregiver role, right? That's important, to share similar experiences and challenges and really help them create that network and provide them, whether it's education, information sharing, and all of that was outlined, I would say, pre-COVID. We had our 2020 plan, our calendar of events and what we were rolling out. And so as we've all gone virtual, that's obviously presented some unique instances, but it was important to keep that network together. And so for our, what we'd regularly have in person, maybe bring in an expert to facilitate a discussion and share with the group. We've now gone online to do that. And we're hosting virtual coffee chats every week. It's just very informal, where working parents can, get online and share with each other any tips and tricks of how they're working through getting the work done while they've got, little kids at home, or they are trying to conduct classes. A lot of them are also playing the role of teacher and helping their children get through that right now, and readjusting to what their summer plans might look like for childcare. And so that network has been incredibly helpful for those associates as well. I know I went through that pretty quickly. We also have a book club discussion that's coming up next week. So that will be great, and we're taking that virtually. Some of you may also be familiar with, or at least I hope, the organization's support in the community. And our 3 pillars, or our values, are really centered around our associates, our clients, and the communities in which we serve and in which we work. And so that support has not slowed us down in light of COVID-19. Recently, Lockton was able to provide $120,000 worth of PPE to our local hospitals and clients. So that was an amazing team effort across several teams to be able to gather those resources and then help share in that. And we're actually currently running a global campaign to raise funds for COVID-19 relief in our local communities. And we're giving our teams, our associates, the ability to nominate organizations to receive those donations from the fundraiser. We're requesting, though, that they're in kind of 3 different areas or capacities, that they fall into either food security, healthcare, and first responder support, and mental health support. So the top 3 are going to be key in terms of how those funds are awarded.
Wonderful. That's just great, Stacey. You all are doing a lot, and I'm looking forward to providing some information through a webinar tomorrow with your managers, and then with associates at large the next day for your May Mental Health Awareness Month. So thank you.
We are thrilled to have you. We're fortunate that we've been able to partner with other providers and experts in the field like yourself to bring some of those educational resources to our associates. And that's been promoted, of course, too, through our workplace platform that I mentioned earlier, and lots of comments that are huge fans of yours, and looking forward to what you have to share there. So.
Well, how fun. I also wanted to comment on your Lockton Parents at Work. This has been such a challenging time for so many, just in how to navigate the various roles, and that you open it to grandparents. A lot of my friends are doing double duty and helping out. Well, so that's just brilliant.
The feedback has really been positive from the associates that have engaged in that, of just having that as an extra support during this time.
And the fact that it's weekly, something to depend on and just to check in. Excellent.
Sorry to interrupt, but we are getting close to time. We have about 10 minutes left, and I know we have one more presenter. We want to be respectful of everyone's time. So I'm keeping record of all the questions, and we will get those answered by our panelists, and I will send out all of the questions with the recorded version of this webinar to everyone in the next couple of days. So just want to be respectful. I know we have 10 minutes left, so I will kick it back to you,
Okay.
Nancy.
All right. Thank you, Madison. And thank you so much, Stacey, for the information about Lockton's efforts. Next up is Dennis Meyer, Co-Executive Director of Synergy Services. Dennis, are you there?
Yes, I am here. Let me get my, the host needs to unblock my video, but so we at Synergy have started working a couple of years ago on developing a framework. With those of you who may not be familiar with Synergy, let me just step back. Synergy provides trauma-informed care to some of the most vulnerable populations. Our mission is to end family violence, and so we have a huge focus on mental health crisis counseling. We have focus on providing homeless crisis shelter for children and youth and victims of survivors of domestic violence. And so we work with a population that is very vulnerable in typical or common times. And of course, in a pandemic, that's even more elevated. Several years ago, we started looking at whether our care for our clients and for our staff was truly trauma-informed. And we a lot of emphasis on doing an agency-wide assessment to determine whether our response to our clients was paying attention to the level of trauma we were seeing and taking care of, and the level of self-care, mental health care for our staff. And we then instituted or started a trauma-informed care committee that it was represented by all departments in our agency, and we began looking at a framework that that could be used for training and ongoing development of procedures and policies and so forth that engaged our staff and improved the just sustained the trauma-informed care for our clients. The second committee that is a part of the umbrella of trauma-informed care, but it's a bit more specific, is a committee on diversity and inclusion. And we felt like that was very important given the vulnerable population that we take care of, because oftentimes folks have, clients and our employees have, of course, histories of cultural trauma, and how we respond, how we hold that, how sensitive we are to that makes a big difference in how safe they feel to engage, the clients and to engage other team members at work. So we took the work of those two committees, and we brought in an outside consultant, the leader for the diversity and inclusion training for Toyota International Committees, and spent several days with us in an agency-wide retreat, and looked at the 6 trauma-informed care principles and how those principles support our core values, and how those core values or how the things we do in our agency either accelerate or inhibit those core values. And so that work has really, that framework has been extraordinarily helpful in this pandemic, because at the end of the day, we have means by which people feel safe enough and trustworthy in each other. We've fortunately have not had any infections, but we've been able to keep our shelters and our emergency facilities open, and we've increased, of course, hazard pay for folks that are essential employees, but more importantly, in terms of their resilience, it's really come forward in this pandemic. And so the foundation that we've laid for the last 2 years, obviously we had no idea that we'd put all this to use during this pandemic, but it kind of goes to the whole presentation of this whole morning, that you prepare and you identify the areas that you think you may yourself be vulnerable, and then you build resiliency so that in a time of crisis, you can rely on that foundation. And so as much as it has been a ton of work, I feel like, to get there, and we're by no means done with that work has really served us well in terms of having a staff that's been very resilient and just amazing through this whole thing.
That's excellent, Dennis. You and Stacey both mentioned core values, and I just wanted to point out that in my research, I explored the neuroscience of priming behaviors, because core values came out so often from organizations that felt that they were doing something organizationally to keep people resilient. And so I looked at the neuroscience behind that. And when you prime people and remind them what behaviors fit with your core values, it makes those behaviors more automatic. It's less stressful for people because they know what to do because you've talked about it explicitly. So that's excellent. Really a great model that you've used. And I hope that listeners know that your staff is small. The other organizations are quite large. And there's so much that you can do as a small employer to help your people be more resilient.
Yeah, we have about 200 employees, but we see probably close to 10,000 clients or patients a year. In crisis care, it's often from 1 day to a week or to 2 weeks, and then folks are back on in their homes or contexts. So we feel very fortunate to have a committed and passionate staff that's also developed the resiliency.
So if employers had people they were concerned about who are in crisis, how do they access you? Actually, you know what? You're in the resource guide in the appendix of the summary report. And I'm sure you're online at Synergy Service.
Yes, and we're glad to respond. I'm glad to share any and all information, as I'm sure all the rest of the presenters are as well.
Great. Thank you, Dennis. So,
Sure.
all of you who are still listening, I want to challenge you to think about what is your next step. How do you start the conversation or continue the conversation in your own workplace? And use the guide that we have provided to talk with your leaders about ways of being visible, using data, initiating peer support, and especially training for managers to get the lingo out there, common language around mental health and resilience. With that, I'd like to thank our speakers, and Madison, turn it back over to you.
Thanks, everyone. Thanks for joining us. Apologies that we had to cut Q&A. It was a good conversation, though. And like I said, we'll answer the questions and send it out to everyone with a recorded version. So thanks again, everyone. Thanks to our Healthy KC sponsors, and hope to see you all soon. Thank you. Have a good day.
Thank you, everyone. Take care. And thank you, Madison and the Chamber.
Thank you all.
Bye-bye.